A very good morning to you, dear listener. Welcome to Perspectives, a current affairs discussion program on iGate Radio 95.5 Star FM, Makudi, Benue State. We sincerely apologize for starting behind schedule. Kindly bear with us. It is due to circumstances beyond our immediate control. Today is a rainy Monday morning in Makudi, the Benue State capital. The rains will not stop us, and we are bringing you this edition of the program, which shall focus on rising cost of drugs in the country. The issue of rising cost of drugs has continued to generate various reactions amongst Nigerians. Recently, the federal government did announce that it has finalized implementation of the executive order on zero value added tax and excise duties on pharmaceutical products and medical devices. The Ministry of Health did announce this, that is going to implement. And of course, last Saturday, the Minister of Health and Coordinating Minister of Social Welfare, Professor Mohammed Pate, did raise concerns about strengthening local production of medical products to address the rising cost of drugs in the country. And research indicates that essential drugs, especially those that are used for serious ailments like cancer, amongst others, have risen to over 400% in the market. To what extent are Nigerians coping with this situation? Does it endanger the health of people? Also, research indicates that basic drugs like anti-malarials have also risen to well over 100%. Is Nigerians' health endangered under this situation? And how can these issues be effectively addressed by the government to ensure that people continue to receive medical care, especially given the current economic realities? These are the issues which I try to find answers to on this edition of the program. I have so far been joined here in the studio by a medical expert who is also in the health sector, the chairman, Association of Medical Laboratory Scientists of Nigeria, Benue State chapter. Dr. Paul Abba is our guest on Perspectives. Good to have you join us here in the studio, sir. Welcome.
Thank you very much.
Good
morning, listeners.
Good morning. We are also expecting the chairman, Pharmaceutical Society of Nigeria, Benue State chapter, pharmacist Ben Ali, who is on his way to join us. As soon as he's here with us in the studio, we will let you know. My name is Nathaniel Nongu, welcoming you to this Monday edition of Perspectives. And if this is your first time tuning into the program, be informed that Perspectives takes the airwaves between now and 11 a.m. and at 10 o'clock we allow you to call in. You can do so by reaching us on 0814-335-9292, 0814-335-9292. The SMS line is 0912-699-9404. We are starting a bit behind schedule, so we'll avail you the other platforms through which you can reach us later on in the course of the program. But Dr. Abba, are you worried as a medical practitioner? Are you worried about the rising cost of drugs in the country?
Yes, sir. I'm very, very worried. Very worried because the life of some people depends on the routine drugs that they take right now. We're talking about cancer patients. Cancer, as we know, is a disease that is very, very destructive and spreads widely. So if you are prescribed drugs, anti-cancer drugs, and you cannot afford it because of the costs, and you are off the drugs, your lifespan will definitely be cut short. Cancer entails a lot of pains. If they don't take these drugs, they can't sleep. So I'm very worried that the cost of these drugs are very, very high these days. And not only cancer, other ailments like hypertension. If you are on antihypertensive and you cannot afford the cost of the drugs, your life is in danger. Because without the drugs, you can't function well. By the time your BP goes so high, your life is in danger. So I'm very worried that the cost of drugs are quite high as it is right now. Even anti-malaria. We Nigerians refer to malaria as ordinary malaria, but mortality due to malaria is high, even in the country. An anti-malaria that is supposed to cost small amount of money, say 500 naira, 600 naira, these days is the last one I bought recently, that's double strength anti-malaria, is 1,200 naira. It's quite expensive. So I'm very worried that the costs of drugs are as high as it is right now. And I want to thank the government for the step they have taken so far. At the opening speech, you mentioned our government has reduced tax to 0%.
Yes, they are yet to implement, but they say they are working towards implementing that.
That's a very good step in the right direction. Because what leads to high cost of these drugs to end users is the tax. The tax on the tax and shipping costs is what led to the high cost. So if federal government will reduce the cost of medical products, medical devices and drugs, definitely that should bring down the price. And then some of these things are what we can produce locally here, if empowered. Some of the drugs, we have qualified pharmacists, who are into production and manufacture. If they are empowered to do so, definitely the cost of drugs will come down. And another thing that is linked to it directly is the cost of production. Power. Power is so expensive. If you're on band A, you know how much you are paying every month. And those of us who are not on any band, we know how much we are paying, and it's really telling on our budget. So government can do a lot more for us by empowering the stakeholders, in addition to the removal of tax, empowering the stakeholders and also doing something about the power sector. If that is done, I believe that the costs of drugs, essential drugs, will definitely come down. Thank you very much.
All right. Thank you very much for the elaborate exposition on that. Particularly, you have also opened our eyes to the fact that essential drugs like anti-hypertensives are also on the rise, which is very true based on the research. That was exactly what I did establish. We have now been joined here in the studio by the chairman, Pharmaceutical Society of Nigeria, Benue State Chapter, pharmacist Ben Ali. Good to have you join us on Agate Radio. Welcome, sir.
Thank you once again for having me.
All right. Before you joined us,
Good morning, pharmacist.
we just started with Dr. Paul Abba, who is the chairman, Association of Medical Laboratory Scientists of Nigeria, Benue State Chapter. And now that you are here with us, we have just started. From your point of view as a pharmacist, give us the reasons why there is a rising cost of drugs, and are you worried about the implications it has on the health of Nigerians?
Late, just having difficulty in accessing this place because of the rain. So I'm sorry for that.
No problem.
The drug is fundamental to human living. It's very fundamental and core to the practice of medicine. As I will always say in the temple of. So it should be a thing of concern to every right-thinking individual, particularly with us that are in the core pharmaceutical sector. That's pushing a lot of our colleagues that are in the community pharmacy out of community service, or what people call business, because it's a situation where you get an ACT. ACT means artemisinin combination therapy. you get for 560 naira and you're selling for 600. By the time you finish selling, they tell you it's 860. According to what our chairman has said earlier, there are some basic ACT that we used to get at this time last year for 400-500 naira. They are 1,000 plus now. So it's a concern to us because it's affecting our practice. People are resorting to other sources. But the reasons are, number one, most of our drugs and pharmaceutical products, they are largely, the economy of pharmacy is largely import-dependent economy. And so as far as the currency that controls the international trade, in most cases the dollar, as far as the price of dollar is unstable, it's rising, the cost of importing drugs and pharmaceutical products will be rising. Then the other thing is the general inflation. I think, as we all know, I got a liter of fuel. I wouldn't want to mention the inflation, but it's not a hidden thing, for 125 naira before coming down here. As of the last time I was here,
125. Maybe you want to tell us so that the other Nigerians can go. If it is truly 125, or you mean 1,000?
1,000.
Oh, sorry, no, 1,250 naira.
Because when you mention 125, Nigerians will be really willing to patronize us.
Yes, it's actually a mistake. You can imagine how my brain is telling me that a liter should be 125, and the reality is 1,250. So
yes.
my brain is refusing to accept the other zero, you see?
Yes.
So another factor affecting the cost of drugs is the general inflation, where you have so much money chasing a few goods or services. Otherwise, how would somebody be getting a liter of petrol for 1,250 naira? Then power instability or power shortage, which drives us to the use of alternative power sources outside of the one provided by the national electricity. And the cost of diesel, the cost of petroleum, even the cost of installation of solar power is not easy. So, and the pharmacists who are in the community pharmacy, who are in the industrial pharmacy, they are industrial pharmacists and community pharmacists, all those things are being factored into the cost of production. And of course, you wouldn't expect the cost of producing a pharmaceutical product when a liter of petrol is 1,250 naira to be the same with when it was 160 naira. So that is a factor affecting it. Then high cost of logistics, largely transportation and storage. Pharmaceutical products are products that must be moved from one point to the other. The excipient to move to the factory. When in the factory and the industries they are produced, there must be a flux. They are taken out of the factory. So the cost, I'll give for instance, recently we had a shipment of 20 cartons of a pharmaceutical product from Lagos. Imagine you spend 140,000 in the haulage of 20 cartons of pharmaceutical products from Lagos to Makurdi. So you must factor in the cost of transportation in addition to the already high cost of purchasing that drug. So we should look in that direction if we really want to solve it. And then the empowerment of the locals to go into manufacturing. And on that note, I was here last year when the Vinca Pharmaceutical Industries Limited did their commissioning August 16th to be precise last year. I think I was invited to this radio station and we spoke about it. The governor was there. He he showed us love, that he's interested in production and those indigenes that are going into production. And he elucidated very wonderful reasons why Vinca Pharmaceuticals Industry Limited should be encouraged, and also encourage a lot of us that are also thinking in that line and the support to give. Nobody runs this thing alone. If you go to the countries where we import, mostly in Europe and Asia, particularly the Asian tigers, China and India, there's a lot of concession, a lot of support, a lot of waivers for their pharmacists who are not any more intelligent than the pharmacists in Nigeria to produce, because the condition is quite conducive for production, where you are sure that if your machine, who is on automation, start production, there's nothing like power outage. But here, when you're operating any automated machine, you must create an alternative power, which is quite expensive. So by the time you are finishing your production, the taxation, every encumbrances are allowed to weigh you down. So only a few people go into production. I wouldn't want to mention, but Emzo Pharmaceutical is another big Nigerian manufacturer. Not until we go full-time into local manufacturing and production, we should be seeing the coming down or the reduction in price and cost of drugs as a mirage. Then inaccessibility to loan facilities from commercial institutions. The Bank of Industry at one point or the other have tried, but the bureaucracies involved in assessing the loan. Somebody that is fully into production or distribution or importation or wholesaling or retailing, and when you assess them for loan, I'm not being specific about them, but because I know that the Bank of Industry is responsible for stimulating those that are in the industrial sector. That's why I've mentioned them. The procedures for assessing loan and commercial and financial facilities, the government should look and the policymakers should look into it and liberalize it a little for pharmacists to get into production, pharmaceutical professionals, pharmacists. Because of the inflation, because of the hardship, because of the insecurity in the country, Benue is not left out. There's a movement, an exodus of pharmacists in the quest, and other healthcare professionals, as a matter of fact, in the quest to seek for greener pasture. The people that were passionate, probably while they were students or while they were in secondary school, to bring in changes when they become pharmaceutical professionals, by the time they are finishing and getting into practice, what we meet on ground is quite discouraging. The pay is appalling. Those in businesses, the condition from the tax and the taxing agent and everything is not encouraging. So a lot of pharmacy planning, some of us is because of the love and probably our age. We're not thinking in that line. But the government should do something in that direction. I think earlier this year, there was a presidential order, a policy of governments trying to restrain the exodus of healthcare professionals, though we know it's against international labor law, but government is government, and they should look into making this condition of service conducive. So the pharmacy immigration is a factor that government and agents of government must look into. So when you bring all these things into play, another one, very fundamental one that is within the purview of the listeners, and the federal government is not stupid by taking the pharmaceutical product, drugs and all pharmaceutical products from the concurrent list to the exclusive list. What that simply means is that the products on the exclusive list is legislated upon only by the federal government. While those on the concurrent list can be legislated. Practicing in these states, it seems there's a poor understanding of that position. And while the government, the federal government, in their own wisdom, have decided to put drugs, pharmaceuticals, I think agricultural products too, under the exclusive list, and at a point give a zero tax waiving, implemented partially, not fully implemented. The president made a remark, a strong presidential statement earlier this year, is to make things easy for the populace, for Nigerians, for the citizens. Because those in community pharmacy, they mark up in percentages. So when the cost of drug is high, the cost of taxation is high, the cost of rent is high, the cost of environmental, every sort of revenue, they see pharmacy as a money spilling machine, or kind of very deep oil well that everybody must sit down, legislate. When you see an outlet that is churning out waste, they will ask the outlets operating 2-3 maybe barbing salon, dangerous waste, human waste, They will ask them to pay 10,000. Maybe they ask. I'm not being specific here, but that is just the pattern. They will ask pharmacy to pay 30,000. They'll bring one gazette for you. Begin to ask yourself: is it this man that is into community pharmacy where people can walk into? Oga, headache, my joint is paining me, my back is paining me, my body is hot, my child is purging. You can just tell them services. These are not traders. They are different from those selling ties. They are different from those selling block. They are different from those selling cement. They are giving services that is in line with the procreation work of God, saving lives, making people not to die. But if you look at their tax gazette that they carry up and from the local government to the state government, urban, everybody, you see that the one for pharmacy is higher. I just don't understand. So I'm calling on the government that if they actually want to work on the cost, on bringing down the cost of drugs, one of the major causes of the high cost of drugs is taxation. Taxation.
That's true.
Harassment. Local government will come, sanitation will come, there will be 16 shops in a plaza. They will leave the other 15 and go to the pharmacy. When you talk, they say this is pharmacy. When you talk, they say there are, I'm the chairman of this, I'm the state chairman, so yes. I receive a lot, apart from my own personal outlets, I have 1 or 2 outlets, I receive complaints from my members. They will tell you that, why is this person paying only this amount? Then when you go there, people gather there. I say, no. If people are gathered in the pharmacy, probably is giving a quality service. In terms of professional citizens and help Nigerians, they will build the cost of that tax into the. You are not helping the citizens. You are punishing your citizens. So I'm appealing that why I'm putting much emphasis on this tax, because I know inflation, import dependency, all those are not within the purview. You cannot control it here. But the tax can be controlled by the state government. I know the governor is doing a lot of things to assuage, to create peace, to create a conducive living, to reduce pressure from the people. And one of the things to do is to look at the taxing system on the pharmacy outlet and invite us. The best way is not to listen to those that are collecting the tax, because they only defend the collection. Is to listen to us, who present facts and to the government, so our government will ease the tension of the citizen. All right. Yes. Thank you very much.
Okay, Dr. Abba.
Yes, sir.
You are a medical laboratory scientist. In the midst of all this, what common ailments are people diagnosed with that will require drug intervention, and what would be the implication on their health at this time that the cost of drugs have risen?
Okay, common ailments that could be diagnosed in the laboratory that will require drug intervention. There are many. Infectious diseases are there. Infectious diseases must be treated with antibiotics, and these are quite expensive drugs too. So doctors refer patients to the laboratory for diagnosis of infectious diseases. Even malaria. Right now, parasite-based diagnosis and treatment is what is happening. You don't just go to the hospital and say you have fever, you have headache, joint pains and all that, and a doctor prescribes anti-malaria for you to go and buy and take. Or you walk into a pharmacy shop and buy anti-malaria and take. That's not the right thing. You should go to see a doctor or go to the laboratory and carry out a blood smear. Let it be diagnosed that you have malaria fever, Plasmodium parasite. If that is done and is accurately done, and an anti-malaria is prescribed for you, and you take the anti-malaria, you get well immediately. There are times somebody will be having fever, and he will just think that it's malaria fever. And you go and buy anti-malaria very expensively, 1,200, 800 naira. You finish the whole dose, and the fever persists. You are not well. It means it's not malaria that is disturbing you. There is need for malaria test, as simple as it is, either RDT or microscopy. It doesn't cost much. I think a maximum of 1,000 naira can help you do malaria tests. And it will be properly diagnosed. You go and buy the anti-malaria, you take it for 3 days, you are well and you are happy. All the symptoms will disappear. Because fever is a symptom of many ailments. If you have typhoid fever, typhoid infection, you have fever. If you have tonsillitis, you will have fever. Even if you are terribly stressed sometimes, you have fever. So don't think that fever is always malaria. When you have fever, it's always malaria. No, go and be properly tested and diagnosed at a health center. It will cost you less. It's cost effective. It will cost you less. Some people now, when they take anti-malaria for 3 days and the malaria does not go, they will think it is resistant malaria. They will go take quinine and some other anti-malaria for resistant malaria, which are also very, very expensive. At the end of the day, having taken all these things, the fever persists. They will now think it is typhoid fever. Then, and every single drug that you take has its side effect. So it's very, very important that you visit a health center, see a physician, let your condition be properly diagnosed before you take any medicine. If not, you're going to waste a lot of money. And I just want to chip in this quickly. These drugs we are talking about, we have diagnostic drugs, we have therapeutic drugs. Diagnostic drugs are such as antibiotic sensitivity discs that are produced by pharmacists and distributed to laboratory department for susceptibility testing of microbes. If somebody is down with an infectious disease and he undergoes a culture test, the bacterium is isolated, you need to carry out what is called susceptibility testing with a battery of antibiotic disc. It is this test that will tell the physician that this particular antibiotic, if taken properly, according to the dosage, will take care of the infection and the person will get well. This antibiotic disc that we're talking about now, of 5 blister cartridges for about 5,000, but right now is about 30,000. A pack of antibiotic disc costs about 30,000 right now. And that will also raise the cost of testing, cost of diagnosis, because you can't, what you used to buy for 5,000, you are now buying at 30,000. You cannot do the test for 1,000 or 1,005 you've been doing. You will also definitely raise the price. So price of diagnosis also has gone up because the diagnostic drugs and equipment and other things that are used for diagnosis, their prices have equally gone up. So what I'm saying is that when you are sick, assess the doctor, get a proper diagnosis, and get a proper prescription from the doctor, and walk into the pharmacy shop and assess your drugs. That way you will spend less on buying drugs on your health. Thank you very much.
But with the situation as it is now, you just mentioned also the cost of diagnosis perhaps going up as a result of given that you also patronize pharmaceutical products and also other medical devices that facilitate your work.
Exactly.
Is the health of citizens endangered under the situation?
Definitely, people cannot afford the cost of doing the proper thing. They resort to alternatives. They go to take herbs. And these herbs, some of them, well, they have their beneficial effect. Some of them, if properly taken, but since there is no dosage form, herbs also destroys the body system. when it is taken wrongly, if it's taken in high doses, uncontrollably, the person will come down and die. There was somebody who had hepatitis. He had hepatitis and the viral load that will tell you the load or the virus in the system. Because without doing that, you shouldn't begin to take treatment. Because it's not everybody that is infected with hepatitis that should be treated. You may be infected, but it has not started affecting your liver, so you shouldn't begin to take treatment, because even the hepatitis drugs are toxic. They are toxic to the liver too. So you should wait. So he has done all that, and he was taking treatment, and the cost of the treatment went so high. He couldn't afford it. In less than 2 days, he died. He died. Because the herbs he was taking, the dosage is not controlled, the condition is not controlled, even the storage, like it's done in the pharmacy. Pharmaceutical drugs sold in the pharmacy are properly controlled, they are properly stored, ambient temperature, and everything is well maintained. And the pharmacist that is dispensing these drugs, they are very, very educated. They know the doses. Even if a mistake is made at the point of prescription, they will correct it. They'll give you the right dose. And you take it, your life is safe. So the life of the citizen is in danger if they cannot afford the diagnosis of their ailment and to take the right drugs. Because of costs, the health is seriously endangered. Thank you, sir.
This is disturbing. Dear listener, if you are just tuning in, you are listening to Perspectives on Agate Radio 95.5 Star FM Makurdi. We are discussing the rising cost of drugs in the country. And you can participate later at 10 o'clock by calling in on 0814-335-9292. 0814-335-9292. Contribution is 0912-699-9404. 0912-699-9404. The line is already activated, and if you are utilizing the platform to reach us, please remember to include your full name and the location where you are sending your contribution from. Log on to our website on www.agateradio.tv.com to find our content and also listen to the radio. You may download the Agate Radio and TV app from Google Play Store, which also serves you to access us. We're available on Radio Garden and on social media platforms where the program is streaming. Join us on these platforms and feel free to drop your comments if they are related. We will take it as your contribution. Pharmacist Ali, the federal government announced that President Bola Tinubu said he has signed executive order to implement value-added tax on excise duty and excise duties on pharmaceutical products and medical devices, which the Ministry of Health did announce just last Wednesday that it has finalized the process for the implementation of that executive order. If implemented, will it actually bring down the cost of drugs in the country?
Meaning, Nigerians, they are Nigerians. But I'm believing largely that if implemented and monitored, because the essence of that executive bill is for
executive order.
Sorry. Executive order.
Yes.
Not a bill, yes.
Very well.
The reason for the executive order is as a palliative or as a way of relieving the Nigerians of the pressure of the high costs of drugs. So when it comes to full implementation, people, particularly in the drug distribution chain, because there's a chain where drugs come in, it goes from the importers to the distributors, to the wholesalers, to the retailers, and to the hospitals, and they are used. It will have positive effects and the cost of drugs will be reduced.
Okay, now let's look at an aspect of local production, which you talked about earlier. Last Saturday, Minister of Health, while speaking at a cancer awareness program organized by the Nigerian Air Force Officers' Wives Association, stated that strengthening local production of medical products and drugs will address the rising cost of drugs in the country. Do we have local producers in the pharmaceutical sector in Nigeria?
We have a lot of them.
Okay, if we have them, why do we still have drugs going up and up?
Nigeria will have a very large population. It's speculated to be over 200
million.
Yes. So for example, in Benue State, I don't think Benue is. I don't know. I'm not vast in the population, but I'm guessing. I don't think Benue State should be less than 10 million.
Yes, going by the official statistics of the census figures of 2006, which is still relied upon, it was projected the state had a population of between 4 to 6 million. But which, of course, the years have gone by now that the figures may have gone up beyond that.
In Benue State here, they may not be able to feed effectively all their drug needs and that of the neighboring state. They may not be able to feed it. But I'm telling you that in Benue State, and probably Taraba, at least for that I'm very sure, we have only 1 or 2 capacity for obvious reasons. The second or the first one around this environment was launched last year in Makurdi here. But I doubt whether the capacity they have, because it's an individual man project who needs another factory without support. So the need of Nigeria, all the factories, all the drug manufacturing factories in Nigeria, when they start production, they cannot meet up to 30% of the drug need of Nigeria. So the place is a virgin sector, is a fertile sector, but the seed that need to be sown into it is not a seed that one man can sow. Mm-hmm. An average pharmacist is trained, in the course of your training, you are trained by about 6 to 7 departments. One is drug formulation and production. It's a department. Pharmaceutics, drug formulation and production. It's a department. So if you see a pharmacist that is trained and licensed to practice, he can produce drugs. And what you need, you just need microbiologists, you need other science, applied science related people that will tell you, that will carry out some basic tests. So the gap is much. And the government have a lot. I'm always calling the government because when you see they mention one machine that will cost you like 200 million. Mm-hmm. How many Benue indigenes that your father is not a privileged politician? In quote, mean that privilege, I don't want to say a stealing politician, or your uncle is not somebody like that can afford 200 million. How many Benue indigenes can legitimately afford that? So it is government that must still come in. And that was what our governor said. I will never forget, because I was privileged to sit with him at the commissioner of Vinca Pharmaceutical Industry Limited. He was so emphatic about the need for the government, for his government, that is production, those that are going to production and creating employment, they are among his 7 core agenda. So I'm still appealing. Anytime I speak, if you speak on radio, I call on the governor to support those that have taken the risk to venture into production, so that those that are dreaming of going in will also come in. Because when you produce here, I've given an instance where 20 cartons of drug was hauled from Lagos to Makurdi here at the cost of 140,000 naira. 140,000 is 2 times the proposed minimum wage. So for bringing in 20 cartons at 7,000 naira per carton, I have paid 2 workers' salary that the federal government have proposed that most states will never pay. Are you getting my point? So encouraging local production will take away a lot of cost. And when a lot of cost is taken away, automatically the cost of the drug will reduce.
Sure.
So the government should encourage local producers. We are just speaking on one aspect. The other aspect is employment. You read industrial chemistry, you read microbiology, you read pharmacy, you have masters in formulation, you don't have where to practice. So the government must come in as a way of a people-oriented program that have a long-term effect to encourage pharmacists that have ventured and want to venture into production. And that would drastically reduce the costs of drugs to the end users.
Okay, Dr. Abba,
Yes,
you
sir.
want to chip in a word on this aspect of encouraging local production of pharmaceutical products, particularly drugs, briefly before we engage with the listener.
Definitely, sir. That is the way out. That is just the way out. If local production is not started, we will continue to have these rising prices in everything. And another one I want to add to it is about local production of vaccines. If you have vaccines that you use to immunize the populace, the citizen, to prevent them from infections, especially infectious disease, you spend less money on drugs because you must be infected and diseased to take drugs. A lot of vaccines were being produced in Nigeria in those days at the Public Health Laboratory in Yaba, Lagos. They produce vaccines for yellow fever, vaccines for a host of other diseases. But the place has been shut down. Every vaccine that is being used in Nigeria right now are imported. And this importation, will definitely hike in the price. You're talking about hepatitis B vaccine, yellow fever vaccine, and others. These are vaccines that can be produced by pharmacists and laboratory scientists in Nigeria. If these vaccines are produced, if these personnel, these health professionals are empowered to produce vaccines, they will help in immunizing the populace. And when the populace is immunized, they come down with less diseases. And then they spend less money on drugs. So I'm completely 110% with him that local production should be encouraged. And that can be done in so many ways. BOI, that's back of industry, and give loan. Government can give grant. And then the cost, the power too, should be looked into. The epileptic supply of power in Nigeria now will discourage anybody from going into production. Because if you are going to use the alternative source of power, using diesel, petrol, they are unaffordable. You want to install solar panels, they are very, very expensive. So the way out is local production. We cannot escape it. If the prices must come down, we have to begin to produce these things that we need by ourselves. That will help to bring down the prices. Thank you, sir.
So we're not largely import dependent. All right, dear listener, it's about time now, 9 for us to engage with you. The line through which you can reach us is 0814-335-9292, 0814-335-9292. Once you connect with us, we're interested in knowing your full name and where you are calling us from. Please remember to move away from your radio set or turn down its volume. Send us an SMS to 0912-699-9404. 0912-699-9404. That line is also available on WhatsApp. Good morning and welcome to Perspectives. Hello.
Good morning.
Good morning to you. Welcome to the program.
Good morning. I need to address.
Thank you. What's the name?
My name is Ivan calling back from Mud Market.
Your name is who?
Ayangi Yoti.
Ayangi Otin, good to have you. What, you calling from Modern Market, you said?
Yes, yes, sir.
All right, Ayangi, go ahead.
I really like the program.
Thank you.
Thank you for the explanation that you just are giving us. I really worry about the cost of drugs where we are in this country now. Some of us now, I'm talking to you, I'm having a challenge of my leg. This is the doctor described drugs for me yesterday. The car Ampiclos, I bought it. 700 naira, 10 tablet on 700 naira, I bought it day before yesterday. So if government do something about it, we really like it.
Okay. Ayangi, thank you. We wish you speedy recovery.
Thank you.
Thank you. All right. 0814-335-9292. 0814-335-9292. The SMS line is 0912-699-9404. 0912-699-9404. That line is also compliant on WhatsApp, but you must include your full name and where you are sending your message from. Good morning. Hello. Hello, good morning. Okay, the line is still available. Kindly to try to call back your on, but we can barely hear you. So, good morning. Hello. Good morning.
Hello, good morning.
Thank you for joining us.
My name is Gideon Nongu. I'm calling from Cashew Newly.
Okay, Gideon Nongu, good to have you here.
Yes, I'm one of the Abba producer, and I want to really know how the impact could be, because really we really lack sponsors concerning these issues, and we really have the talent to produce this medicine even far and wide, because pertaining even hepatitis B or like typhoid.
Our focus is not on herbal medicine, but orthodox drugs anyway. But we thank you for calling in.
Okay, herbal medicine to you people should always advise, because it reduces cost.
All right, thank you very much. when we get the appropriate experts to advise in that area, we don't just give our advice here. We depend on what the experts are telling us. All the same, we thank you for calling in. Good morning.
Hello, good morning.
Thank you for joining us.
Yes, my name is Jude Perry.
Thank you for joining us, Jude.
Yes, I'm calling from Bakuma, Way East.
All right.
I salute your panelists that have done justice to this topic. There's nothing that will contribute much. They have said about the zero taxation. And I want to also add, the road networks in Nigeria are bad. It's a terrible situation. So the federal government should also endeavor to renovate or rehabilitate roads, that the road network will be good for transporters to move goods and services to and from.
All right.
Thank you.
Thank you, Jude. 0814-335-9292. Send us an SMS to 0912-699-9404. We're interested in knowing how citizens are coping with the rising cost of drugs and its implications on the health of the people. Good morning.
Good morning, Mr. Nat.
Thank you for joining us on Perspectives.
Yes, I'm Kwangutaya from Bajimba.
Okay, hi, it's Bajimba this morning.
Oh, thank God.
All right, Kwangu, go ahead.
Me, I don't want to talk about government too, because that one is above my power. But I want to appeal. Sorry, my greetings for guests in the studio.
Thank you.
Thank you.
I want to appeal to the pharmacy or the drug seller. No, the way the drugs are going high, the cost of drugs is going high, it's making life unbearable to us. As I'm speaking to you now, I'm not fine, but if I want to buy drugs now, the money will be much higher than which I don't have the money. So I'm appealing to them that, because even as the condition, we understand the condition, the cost of fuel and all that, they should consider all the vulnerable people. So if they can put effort to at least minimize the cost of drugs, it will be helpful. They should not just use the government listen to punish us. We know the government is not doing well and everything is going high, but they should also consider they are humans just like us. So they should, at least the drug sellers or the pharmacists, they should do something that at least would minimize the cost of drugs. Thank you. That's my take.
Thank you, Kwangu. Thank you, Kwangu Tahaf. Okay, when we come back, certainly we are going to hear from Pharmacist Ali. You'll be telling us whether your society regulates these prices so as not to exploit citizens unnecessarily. Good morning.
Good morning, Nathaniel.
Thank you for joining us on Perspectives.
Honorable James from Abba in Bokuta government of Benue State. You know, food itself is medicine.
James,
and many people are not.
The network in Akba seems to be very unfriendly. It's breaking.
Okay.
You want to change
Can
your
you get me now?
Yeah, speak on.
Yes, I was trying to say many people are not affording food, like balanced diet, because food itself is medicine. And as far as many people are not affording it, they have to, reach out to the orthodox drugs that will help supplement their health. And as the prices of drugs are skyrocketing, life becomes so difficult for the vulnerable people. So government should just quickly do something. If it is failing us in other sectors, but here life is concerned, so the government should do something very quickly to bring factories that will be manufacturing drugs locally here, and to and all that will be reduced. And people that are operating in that sector should be mindful of the fact that there are a lot of people that are very vulnerable and are sick and they don't have any help. They are relying on them.
James,
so no matter what, they should try to cut down the cost.
Thank you, James.
Because as far as the things are in the country now, a lot of people cannot cope.
All right. Thank you. Thank you very much, James, for making your submission. Drugs are essential and they should be sold with some form of human face prices to enable the citizens cope. Welcome to the program.
Yeah, good morning.
Morning to you. Thank you for joining us.
Yes, I'm Thomas Doyle. I'm calling from that we are talking about. First of all, government needed to assist Nigeria because we are passing through a lot. And the challenges that we have concerning drugs, most of the drugs are even selling quack or let me say those pharmacies, quack pharmacies. There's a pharmacist in Achusa here. I was having malaria or typhoid or whatever they will call it. I go there for a test. These people run me a test and they gave me the result that I don't have any malaria. And when I came back, the drugs they gave me, they checked on 1 or 2 drugs with the prison text. I spent like 3,500. I came back. I could not be able to sleep that night. I have to run to the hospital the next morning. When they check me, they say my malaria is very high. So the pharmacist, the organ in charge of pharmacists there in the studio, let them also try to check this their quack people that they are not even qualified, are even killing people. Because you get there, you go, like I don't just go and buy drugs, I will go say I wanted to see the pharmacist. I'm living around Achusa. The pharmacist in Achusa, I went there. I did not say give me drugs. I said I'm noticing something like this. So please, I want to run a test. I still tell me that.
Okay.
He run a test, he collected the money, and I still don't get the result.
Okay.
So please,
Thomas,
work hard.
Thomas.
Yes.
Yes. Before you conclude your points, we'd like to find out from you. You said this is a pharmacy. Yes. Do they have a diagnostic laboratory?
Yes, they have.
Okay.
They take my blood here, they run the test, I pay for the test and the drugs they gave me. You understand? So, but I could not even sleep that night because I even said this is something that makes somebody to be mad.
Okay.
So it's God that saved me. So that's the challenges we are having. And come to the section of this, the people that they want to put them in charge of those places. They need to screen those people. Then even the government carry money and just put in there and let them be where they'll be producing drugs and all this. If we still don't have good people, we'll still be zero.
Okay.
So we still have a lot to do, and they have to work hard.
Thomas, thank you. Thank you for drawing our attention to that. We hope we'll discuss that certainly, and I believe the chairman of Pharmaceutical Society in the state is noting. Thank God we have medical laboratory scientists in the studio. We are going to examine whether it is also in the place of the pharmacist to operate laboratories. Good morning. Hello, thank you for joining us.
Good morning, sir.
Morning. You sound so low. Could you speak up so we hear you better?
Okay. This is Big Man calling from sir.
Big Man, on this program, we're interested in people's real names and not nicknames.
Sir?
Okay, I'm sorry, Big Man. You may have to call back. 0814-335-9292. 0814-335-9292. We're interested in knowing people's real names on this program and not your nicknames, like I mentioned. Hello, good morning. Hello. Good morning.
Hello, good morning, Mr. Nat.
Thank you for calling in on Perspectives.
From Bachohon Council Ward of Gwe West Local Government.
Thank you for joining us. Go ahead, Bartholomew.
Yes, the topic you people brought on board is very important. You see, the high cost of these drugs we are talking about have subject of living in Nigeria is very high. And coupled with the cost of these drugs, a common man is to buy. When you visit the hospital you run some of these tests. That is not all. Running a test, you will know your problem, and that is not all. You need to get these drugs for proper treatment. And for you to get these drugs, it is very costly. So we are appealing, as the guests in the studio have said, the government of Nigeria should do something over this. These taxes they are talking about, maybe based on what they've said, they are too much for them to couple with that. And again, I have a question I may like the guests in the studio to throw more light. What are the steps they are doing in order to cope this issue of fake drugs we have? Again, what are the ways for them to enlighten we the common men to know the difference between a fake drug and a real drug?
Okay.
Lastly, they should also checkmate the quack personnel they have around.
Thank you.
That will also help and reduce the rate of death we have.
Thank you, Bartholomew. Thank you for calling in. 0814-335-9292. 0814-335-9292. The SMS line is 0912-699-9404. These are genuine concerns we'd like to hear from you as they relate to the subject matter we are discussing. Good morning.
Hello.
Thank you for joining us. You may move away from your radio set, if you may.
Good morning, sir, and the people in the studio.
Good morning.
Good morning.
My concern is about the hike of this price of these drugs.
Yes. First, we should know your name and where you're calling
I am Sir Isaac Iwachibi, calling from Tsechibi, Genabe.
Thank you. Go ahead, Isaac. You are.
My contribution is that I wish the two people in the house, especially the ones concerning the drugs formulation, if they can come together and maybe with the organization go to government and maybe set a tripartite issue, like people who are interested in bringing their money for setting of this pharmaceutical production company and the government, and then themselves, the pharmaceutical intelligent people. I think if they can come together like that, there will be money for them to set up a pharmaceutical company that will be producing maybe cheaper.
Okay, so you are talking about the public-private partnership, right?
Yes, we're putting them.
Okay.
Like people are interested, like me, like this, I'm interested. If a tripartite something like that, government to liquidate, bring their own quota, and them themselves bring their quota, and the other public people bring their quota, and then something will be done like that.
Okay.
I think if that kind of notion is considered,
all right, thank you.
it will reduce the price too, because when the Vinca, as you were talking about it.
Thank you, sir. Thank you for calling in. We appreciate you. Okay, let's speak to some of these concerns before we engage with more people, and we'll begin a point a day with the issue, the concern raised by Thomas Doyle, who mentioned how he was diagnosed in a pharmacy. Pharmacist Ali, do you pharmacists also have the mandate to diagnose people before giving them drugs?
Thank you very much. I specifically took note of Mr. Thomas Doyle, the one that called from Achusa.
Yes.
In my last appearance here, I tried to draw attention of listeners to the difference, and also draw the attention and educate them on the difference between what is a pharmacy outlet and a PMS outlet. I am the chairman of the Pharmaceutical Society of Nigeria.
By PMS here, you mean patent medicine
stores.
Very well. So,
yes.
So we get to.
I'm the chairman of the Pharmaceutical Society of Nigeria, Benue State branch, and I'm also the co-chairman under the chairmanship of the Director of Pharmaceutical Services, the DPS, Benue State Ministry of Health. I'm the co-chairman of Pharmaceutical Inspection
Task Force
Committee. The Tassisi State and the FCT is the chairman of the patent medicine stores, and those are pretty patent medicine stores are called patent medicine vendors, and the operator under the licenses from the Pharmacy Council of Nigeria. Why am I giving this arrangement, this background? Because where the people are not so enlightened, wherever drug is being sold or dispensed or kept, is taken to be a pharmacy. No, it is not so. The pharmacy is under the supervision and the control of dispensing, including biochemistry, microbiology, to become a pharmacist. So, but in a community where people are not enlightened, they refer to PMS. When you say Achusa, my brain have been traveling around Achusa to know where there's a pharmacy. I think I know there's one pharmacy.
If he had told us the
name of the place, but because the program is not aimed at it's aimed at educating, not aimed at Pharm pharmacy in Achusa, which I can get to that to ascertain what you're saying. And coming back to your question, you say whether they are trained in diagnosis. The first stage in the medical practice, the medical practice comprises of all the members of the healthcare team. And the members of the healthcare team, for purpose of emphasis, they are the doctors, the pharmacists, the medical lab scientists, the nurses, not in any order of importance anyway. Do you understand? The clinical psychologists, even the record, those people that issue you card, because if you don't have a card, you will not even see a doctor. Mm-hmm. It's a teamwork where everybody have a clear-cut responsibility, though it overlaps where the personnel and the professionals are inadequate. So the role of a pharmacy, the pharmacy is trained to also diagnose, because if you don't diagnose, there are a lot of times people will not get to you. There are quick diagnostic tools that are used these days, like something like malaria. Even the kit is self-explanatory. But there are diagnoses that are not basic and lead to you. It's advisable you go to the lab. When you have a community outlet too, what we call community pharmacy, lab scientists to establish close to doing diagnosis. But when you engage with them, the malaria, pregnancy test kit, those diagnoses, these are small things that people are even taught to do at home. Patients are educated to do basic BP check, sugar, those things we also do. We're all trained for that. But what the person is saying, that he went home, as a medical person, I disbelieve somebody until the person proves me right to believe in. Contrary to others, they will trust you first. Until you prove them wrong, then they'll distrust you. Because we have had instances where a patient will come, he say he has taken all the drugs, it's not working. He has run all the tests, it's not working. Then I ask, what is LFT? He doesn't know, a liver function test. You say, do you know vancomycin? So he say, but you say you have taken all the drugs. So it's not, you check your BP to know the level of BP to advise you appropriately. There are sugar level diagnostic tools that can do instantaneously and get your result immediately. Malaria test kit, you do rapidly and get your result. So those one, the community pharmacists, they have basic training to do them, and they do them. But any test that is going to sensitivity and all those things, you refer them to a licensed medical laboratory. And I want people to know that any premises that is pharmacy is registered, and always they have the green logo, the green cross logo. That is a sign that the person is registered. And the registration is not forever. It's renewed every year. Every year. If you register this year, to elapse 31st of December of that year, and next year the indices that is qualified to register, if they are there, we renew. The license is renewable on a yearly basis.
Okay, now you have established this, but the patent medicine stores, which you stated, which is to say they are not subsumed under the categories of pharmacies. Who controls the patent medicine stores?
That's what I've told you earlier, that the Pharmaceutical Inspectorate Committee controls the production, distribution, storage, dispensing, sales, and the licensing of those that's involved in sale, whether patent medicine vendors and pharmacists. They recommend to the Pharmacists Council of Nigeria for licensing. So the supervision is under the PIC, not directly under myself, but I'm the deputy chairman of the committee. Okay. So that's why I took note of all those things. But when we came here earlier, we said, we gave our challenges. You are supervising, regulating, controlling patent medicine stores in 23 local governments of Benue State. We summon resources, we gather resources. Recently, I was posted to Abba. Before I could finish from Gbokpo to Iga, I couldn't even go to the other villages again. We left that place 8 p.m. We left Makodi around 8 in the morning, of course, because of the fuel, before we could reach Utupo reach. Do you understand? So the government must come to the aid. The PIC, as I'm talking to you, have one dysfunctional Hilux vehicle, which cannot even circulate and work within North Bank and this thing effectively. So how do you use one Hilux vehicle for effective supervision? I'm not a government person, I'm from the union aspect, but I'm speaking on behalf of the DPS. And those that are in government, they may not have the courage or the confidence to talk to the government. But it is appalling that a state as wide as Benue State have one vehicle assigned for inspection. Dysfunctional. This is not working, a lot of things are not working. And the repairs is being carried out by the office of the DPS and the contribution by pharmacists. So see the danger. I am contributing, I'm trying to support you to inspect me. Won't you affect your work? So I'm still calling on government to support the office of the Director of Pharmaceutical Services, DPS Benue State, and the Pharmaceutical Inspection Committee, which is responsible for regulating and inspecting the action and work of all pharmacies in Benue State and all patent medicine stores. It will bring the result that the people are already crying about, and to make this inspection and supervision more effective and biting. Thank you very much.
Okay. I'll just a moment. Hello, good morning.
Hello, good morning. Yes, I'm Thomas. You're calling back.
Okay, Thomas, you listen to...
Yes, I want
to tell us the name.
Yes, I listen to him, and I want to clear this. As I'm speaking to you, I'm not a child. I'm a family man.
Thomas,
and I'm very
go straight to your point. Stop the rambling.
Let me tell us the name of the
shop. I have the proof. And when I even went to the hospital the next day, when they run all the tests, was still that malaria something that I noticed, and I asked for the text. You understand? So, had it been something else, whether my BP, my heart, whatever thing that was my problem, I should have not even mentioned this. For somebody to make you, I even went back to the hospital. I wanted to collect my money back. Somebody calmed me down.
Okay.
So I was not happy with them.
Thomas,
that's why I mentioned this issue.
Thomas.
And as I'm coming, As we are speaking, we have only one pharmacy in Achisa.
Okay.
The other one is the chemist. The guy is trying.
That's okay.
One pharmacy in Achisa. I don't want to call the name.
No, not at all. We are not encouraging that. That's okay. Your point is noted. Thomas, what I will require you to do privately is send us an SMS to 0912 699 9404. 0912 699 9404. Send an SMS to that line, identify this pharmacy, so we can give it to the chairman of the Pharmaceutical Society to investigate. If it is true, it is an allegation. So if it is true that the pharmacy is indulging in that, it should get the appropriate committees or inspectorate departments to act. Morning to you.
Yes, Igbodu Tenenge calling from BC.
Okay, good to have you here, Igbodu Tenenge.
Yes, actually the roles performed by most of these pharmacy and these patent stuff cannot be overemphasized, because most of them, they do what they are not supposed to do. I came across a patent store along Akpehi Road. She could not handle it, and I just went there just to buy, I think, methylated spirit. I have to help her to deliver the baby. So I was asking myself, what if I wasn't there? Okay, they said this woman was a nurse, I did something, a community health, and she's taking delivery in a patent store. So it's high time the regulatory body should start monitoring them strictly, where they call them O2, they call them doctors, and they perform miracles. So I think it's high time the regulatory body should do what they are supposed to do. Pharmacists should stick to their own role. Patent stores stick to their own role. Okay. I think that is my little contribution.
Thank you, Tenenge. Thank you. Anyway, we will not take away our discussion away from our subject, which is the drugs issue we are discussing. But if it comes related to the drug, we will tie to that, because it's not quackery in the medical profession in general that we are discussing. But pharmacists, Dr. Abba, I beg your pardon.
Yes, sir.
The aspect of pharmacists also operating diagnostic laboratories and prescribing or administering drugs, is it a correct one?
Definitely it's not correct. My pharmacist friend here have said that anybody can do RDT test, pregnancy test, fasting blood sugar test, and all that. Well, it is not the doing or how difficult the test is that is the problem.
Interpretation.
What are you licensed to do this? Anything that your license does not cover and you're doing it, it amounts to quackery. It's amount to quackery. No, because like this scenario now, this person went for a malaria test and they used RDT and it was negative. And he went to the hospital. I guess they did malaria test by microscopy and it was positive. They saw malaria parasites and he was treated for malaria and he got well. You see, that when you don't have complete knowledge of something, it's not good to delve into it. Like now, there is what we call low-density malaria, low-density parasitemia. You need to have about 120 microliter, 120 parasite per microliter of blood before RDT is positive. And if somebody is having low-density malaria and you do RDT and it's negative, you assume that the person doesn't have malaria because you don't have the capacity to do malaria microscopy using blood smear. So you stop at RDT and you tell the person where you can go. You don't have malaria. Meanwhile, he's dying with malaria. So himself knows we are not here to fight each other, and that's not the purpose. We are here to collaborate.
Very well.
He knows that it's not their place to run diagnostic tests, whether it is PT. If you can do a PT for somebody that with urine, early morning urine, EMU, and it's negative. It will be negative, especially early pregnancy. It's negative. But when it's taken to the lab and they use, they check beta HCG, it comes positive. So the diagnosis is already missed when you use EMU and it's negative and you dismiss it as negative. So it's true that people, nurses, pharmacists, doctors in their clinics are doing some tests, but they know it's not right. It's not the right thing to do. The right thing is to send the person to the laboratory, let specimens be collected, and proper tests be done with properly calibrated equipment, and then an accurate result comes out. And then based on that result, prescription is made, and then drugs are dispensed. The patient goes home taking his drugs and gets well and is happy. That's the right thing to do. But in Nigeria, almost anything goes. The war against quackery is not a war that can be won very soon. It's happening everywhere, both in the laboratory sector, in the pharmacy sector, medical sector, engineering sector, in every way. A lot of people are posing as doctors in the village.
We face it in the media industry too.
Right? So it's everywhere, but those of us that are adequately educated should fight it with all the energy in us and try to stop it in our territory.
Okay.
Thank you, sir.
Good morning and welcome to Perspectives.
Mr. Nat, good morning, sir.
Morning to you.
And regards to the guest in the studio.
Thank you.
Oku Moses is calling from North Bank, Makodi.
Good to have you, Oku Moses. Go ahead with your point.
Thank you. I want to advise government to act fast in this, because the life of each citizen is at stake if they don't act fast. Even the orthodox or the alternative means of treatment is also still on a high side, because if you go to the pharmacy and you cannot afford to buy, you say, let me go to alternative. And that alternative, if you go and ask them now, those Yoruba women selling by the roadside, something we used to buy at 100 naira before, it's now 200 naira. Okay, by the time you take it to 200 naira today, it's not going to serve as in it's not going to quench the treatment or whatsoever. Tomorrow you have to take, next tomorrow you have to take. If you check all those things, it's still equivalent to a pharmacy or whatsoever. And so I want to beg the federal government to act fast.
Okay.
At least. So that's my submission.
Thank you, Oku Moses. Thank you. Government should act fast because the health of citizens is endangered already with the rising cost of drugs. A few messages before we come back. Veyo Teso from Welfare Quarters. He says diabetes has now become rampant and the cost of treatment is equally high. So I am appealing to the government to subsidize diabetes drugs like HIV and AIDS and others. Thank you. Okay, Teso, thank you for your message. We'll have another one here. Unfortunately, there's no name to it. Good morning, presenter. The high cost of drugs can only be controlled by the government through reduction of taxes on importation of drugs. Encourage local production. Ben from AP. Okay, Ben, thank you for your message. You didn't put your full name. Hello, good morning. Another one here says, okay, this too doesn't have a name, and our tradition is we take only messages with names to it. Good morning.
Issued an executive order of no value-added tax on pharmaceutical products. No, that is empty words. Already in the law, pharmaceutical products and medical consumables are exempt from value-added tax. Already. That is already in the value-added tax law. So they are not telling us the truth. What they should do is grant tax holiday to all the pharmaceutical companies operating in Nigeria. There is that provision in the law already, that if there is a need, the type of need that now exist in the pharmaceutical products. They can grant 5 years tax holiday on the pharmaceutical product, and that will attract investment, even foreign investors, to come in. And the federal government has to look at the whole gamut of taxes in this country. There are too many taxes on manufacturing companies. Again, what the federal government has to do, it is really beats everybody's imagination to float your currency when you import 90% of your manufactured goods. I don't know what kind of economic things our federal government has. Hello?
Yes, your answer. Try to conclude now.
Okay. That is my conclusion. The infrastructure is poor. Then the naira is very low. How can cost of things not rise?
Okay, sir.
No electricity. You depend on diesel to power your industry for manufacturing, and diesel is very expensive. Government is not just subsidizing anything now.
Okay, thank you, sir. Thank you for your contribution.
Thank you, Nathaniel.
Thank you. Have a good day. All right, tax holidays. I think the pharmacist Ali will note to that it's quite a cheering one for such a recommendation coming from callers. Good morning.
Good morning.
Thank you for calling in.
This is Isaac.
We are listening to you.
Sorry, I'm just...
And you'll be positioned to. That's the line to participate.
Good morning to your guests in the studio there.
Thank you.
I am Engineer Sunday Abba, calling from North Bank.
Okay, this North Bank people have decided to hijack our line. All right.
Seriously, yes. I must start by saying I am a qualified professional engineer, not a quack one. Okay.
That's nice to know.
Yes. Now, I think the old saying that prevention is better than cure, Nigeria should imbibe it as much as possible. Let's try to live healthy lifestyle so that we don't fall sick. But if we fall sick, we must do proper treatment by first going to the clinic or hospital. The doctor will examine you, then they will recommend you to go to laboratory for a test. And when the test is properly done, go back to the doctor, he prescribe the drug for you, then you go to the pharmacy and get. But what we do here in Nigeria, people go straight to the lab and say, do me this test. And the last thing will do, which test are you doing? Who recommended it? The proper test to be recommended is when the doctor has examined you, combined with the clinical examination, then they prescribe the appropriate test.
Okay.
So most of them, they misdiagnose the test. Then you go and buy drugs. They go to chemists. They say, no, this thing woman, they miss drug for me. Miss with drug.
Sunday.
And they spend money.
Sunday,
and so they put themselves in precarious condition. So my advice is that let's do it properly.
All right.
First of all, do prevention. But if you fall sick, go to the hospital. Doctor will examine you, recommend the appropriate.
Thank you very much. That you have stated already. We appreciate you for calling in. That's a general advice for you. You are an engineer, but you are speaking more like a doctor.
Medical person.
By 0814-335-9292. Hello.
I'm from BSC this morning.
Okay, good to have you join us via Simotun.
Yes, I appreciate your guests so much for the insight they have given on this issue. Well, they have said it all. We really need the intervention of federal government on this issue. Just like Eda Chavi have said from North Bank. Or the government is just playing lip services to what they are saying. And that's the fact. We are appealing to federal government that they are the ones we look up to for such things when they are up. I am badly affected. I know the amount of drugs I buy for my mom. Okay, the anti-BP drugs, they are going higher and higher. I used to buy biopentin at the rate of this. It has gone, in fact, let me say it has gone more than 100%. And that is how it keeps going up. Who are you to ask? Nobody. we are looking up to federal government to do a review. Let them not play lip services. Let them be firm on the decisions they are taking. Let it be implementable and not other way around.
Okay.
Just like well, in any case, I think that's all. They really need to do something. These drugs are going high.
Thank you, Fiase.
And if you are not healthy, how will you walk? How will you move around?
Thank you for your concern.
So sad.
Thank you very much for calling in. That will be the last call we will accommodate on today's edition. Pharmacist Ali, does your society, Pharmaceutical Society, have a benchmark of prices you give to your colleagues to sell certain drugs, especially essential ones?
The drug distribution system currently operated is chaotic. And the Pharmaceutical Society of Nigeria, the national body, and all the organs of pharmacy society, they'll be advocating for a centralized drug distribution system in the country, where from the factory to go through them. It is when that is done with central medical stores, with central stores, coordinated drug distribution centers, that we can control it. But now the drug comes in from everywhere. Drug comes into the country from everywhere at cost that nobody knows, and the prices are fixed, prices that nobody knows. I'm speaking as a union leader and also as somebody in the business, in the community service practice. So what you get, you sell at a markup. Why a markup? So that you cannot be pushed out of, in quotes, business. Do you understand? So when you get paracetamol at the company price of 35 or 40 naira, you use 1.25, you sell for 50 naira. But now you get paracetamol at once. I think a kind of paracetamol, Emzo, is around 200 naira, for instance. That man that...
And that was just about 50 naira.
At about this time last year, it was 50 naira.
Yes.
So the inflation is, just as the last caller spoke, I'm just excited today because the callers are very informed callers. So it make my work easier. The other man explained what I should have explained. I've just told them to explain about the lip service nature of government promise at all level. So there should be a level of sincerity on our part. And we should also sit down and prioritize our needs. When we prioritize, and both government and people, the man started talking from living a healthy lifestyle. You understand? So must somebody have HIV before government intervene, before NGO intervene? People are dying more of diabetes and these things, even more than the HIV. So
yes,
why are they not intervening?
One of the messages I read stated a concern about diabetic patients.
And
of
malaria,
course, the research also, my investigation revealed that drugs for diabetes in particular have also gone above the rooftop. Insulin that sustains the diabetic patient is high. The price, all of that.
In tens of thousands, from 4,000 to tens of thousands, over 20, 30,000.
But people should be worried that you sell at markup prices, which is to say your members don't fix prices with a human face. Everybody determines.
So what is markup? Markup, somebody saying is when this drug arrives at this point, I'm using 10%. What it means 10%, or let me go 20%. What it means to sell 20%, you bought something at 4,000 naira. You are selling no more than 4,800 naira. It's from that thing you are paying for this. I have a pharmacy that operates 24 hours. God is my witness. I use fuel 8 liters per day. And unfortunately, sometimes between 6 p.m. and the next morning, you don't sell up to 80,000. And if you're using a markup of 10%, for you to access a profit of 8,000 naira, you must sell above 80,000 naira if you are using 10% markup. So, but some people have already set up a name that you say, okay, your website, you are doing 24-hour pharmacy. You don't want to go back because of what people we're going to say, that this guy cannot sustain what he has started. They are passing through things. How I wish you will have a time to visit independently. Maybe one time, after 2 months, visit again. The stock is going down. The cost of running business, 1 liter of a sub-liter, the liter is not up to 1,000 mils. The liter they are saying now, most finished are not up to original value of liter. And you are paying 1,400. And you are running generator for industry or fridge. That is stealing. Somebody that are paying 30,000 naira, you know he's taking Okada to work 1,000, taking back 1,000, 2,000, 60,000. You ask yourself, or doing something. How can you be earning 30,000 and you are taking Okada to and fro work 60,000 if you attend work? So the pharmacists are losing in all facets, in all frankness. But they don't have any other business to leave the parts of the profession into it.
When you say pharmacists are losing, the citizens are feeling it more than even the pharmacists. But that's okay. That is not too.
No, you are correct.
That is not. Yes,
you are very, very correct.
Yes.
I know I've told you when the BRS people and others will come to us, I say these people are not in business; they are in service. Imagine you are losing, and you are still in service, and you are still giving the service you are giving. That's why they call them community. Their aim is different. It's not capital oriented. Capital is not their primary motive. But it's a humanitarian work. The community pharmacists
it's okay. I must interrupt you because we are running out of time already.
I understand. Thank you,
Dr. Abba.
Yes, sir.
Where do we go from here? From the drug value chain, diagnostic value chain, everywhere the citizen is feeling the pinch of it. Where do we go from here? That should be your concluding thoughts.
Wonderful. We run back to God. You know, in Nigeria, we believe in God so much. But more than that, we really need to do the right thing. Government has to empower the people for local production. If we must have the price down, government must have to empower the people for local production. And they also have to do something about power. Everybody is crying now. NEPA bills, food, diesel costs, and all that. Government should come to our aid. Government should help us. And another thing I want to say about diagnosis. These days, I see a lot of companies, a lot of vendors coming to place equipment in your lab and different places. Say, don't pay for them. Only be buying the reagents. It's a very deceptive ploy to cage you in. Once you pick this equipment and you are buying their reagent, they keep raising the prices of their reagent. And when you are buying out of service, we don't want to call it business. It's a humanitarian service. But then you cannot run it at a loss. So government should help people, give grants, give loans to buy equipment and to produce locally and to provide service locally. If not, if we continue to import everything and at the level of the power now, no price will come down.
Okay.
No price will come down.
Pharmacist Ali, just 30 seconds of your parting words, especially with regards to the challenge of fake drugs that may saturate the markets at this point now that the prices have gone up.
Faking of a product is stimulated by high cost of the product. When the card of ampiclos, as the caller said, is 700, those that want to fake it, there will be more profit for the fakers. And for you to regulate the fakers properly and stop them, if possible, is to empower the regulators, which I've mentioned earlier, the Pharmaceutical Inspectorate Committee. One dysfunctional Hilux vehicle provided by the Benue State government to regulate 23 local governments. It is impossible. You cannot have effective regulation without investing in that area. But the government may not be seeing the danger because they are not in the clinical practice. The danger crisscrossed to every nook and cranny of the state, and it affects everybody. Is a potential victim of fake drug, even the governor, even the president, because he only take drug, he doesn't know the content of what he's taking. So they should encourage the PIC, Pharmacy Inspectorate Committee, NAFDAC, all the people responsible for regulation with functional resources so that they can regulate them. The drug faking is real, and we have the capacity to reduce it, but lack the resources.
As a follow-up, we certainly get to hear from NAFDAC what perhaps they may be doing with regards to addressing the challenge of faking. I must appreciate Pharmacist Ben Ali, Chairman, Pharmaceutical Society of Nigeria, Benue State Chapter, for his valuable insights on the program. Thank you very much for coming.
You're welcome.
Dr. Paul Abba is the Chairman, Association of Medical Laboratory Scientists of Nigeria, Benue State Chapter. Thank you, Dr. Abba, for your time.
Thank you very much for having me.
Dear listener, that's our program today. Join us Wednesday for a fresh edition. I Get Radio care about your health. Stay safe and God bless you. I'll be with you on Wednesday. Goodbye.